Good day, ICD coders, CWT participants. On behalf of the CDC Foundation, I warmly welcome you to CWT 2024. We are thrilled to have such a diverse and talented group of ICD professionals joining us from across the globe. As we embark on this journey together over the next few months, our goal is not just to share knowledge, but to foster a community of learning, collaboration, and innovation. The challenges we face in ICD coding are vast and complex, but with your passion, expertise, and the support of the CDC Foundation, we are more equipped than ever to make a significant impact. We start this year's training with the much-awaited session on ICD-10 coding of neoplasm, packed with engaging sessions, hands-on workshops, and insightful discussions led by some of the leading experts in our field. Our team at the CDC Foundation includes ICD experts Patricia Wood and Saman Gamag, as well as our leader Sam Notson and at the Foundation and his assistant Jean Nguessan. Your presenter for the coding neoplasm session is Dr. Yusuf Ahmed, mortality classification specialist and ICD consultant at the CDC Foundation. This presentation is based on guidelines and rules for neoplasm mortality coding in ICD-10 2016 Volume 2. Additional explanatory notes and examples have been included without altering the original instructions from Volume 2 2016. Notes and instructions can also be found at the beginning of Chapter 2 in Volume 1 tabular list, specifically focusing on neoplasms. C00 to D48 on page 167. Further notes can be referenced in Volume 3, specifically in the alphabetical index to diseases and nature of injury, indexed as neoplasm, starting from page 435. Additionally, after the presentation, exercises will be provided to assess the understanding and effectiveness of the presentation in relation to the relevant sections of the 2016 ICD-10 Volume 2. This slide features a flowchart illustrating the ICD coding process related to medical certification and causes of death. The flowchart consists of three main blocks with sequential steps. First, cause of death in a medical certificate refers to the international form and guidelines in Volume 2 for filling it on Annex 7, page 203. Second, direct ICD-10 coding using index and tabular list that involves basic coding guidelines from Volume 2, page 28, section 33. Lastly, selection of underlying cause of death includes steps SP1 to 8 and modification rules 1 to 4 for mortality coding in Volume 2, starting from page 31, section 4. The slide uses a simple layout with clear objectives and topics for each session, emphasizing a professional and informative approach to neoplasm coding training. The CWT training will consist of 4 sessions, which covers Session 1, Introduction to Neoplasm Coding, whose objective is to understand malignant neoplasm coding basics, focusing on behavior, topography, and morphology. Session 2, Primary and Secondary Coding Malignant Neoplasms, whose objective is to review guidelines for coding malignant neoplasms, including multiple cause codes and secondary coding for malignancy. Session 3, situations where there are more than one primary malignant neoplasm. The objective is to address complex scenarios involving multiple primary malignant neoplasms and ambiguous site indications. Session 4. Cases that involve metastatic cancer coding will focus on coding metastatic cancers and understand metastatic from and metastasis to concepts. The objective of session 1 is to define neoplasms and cover the basics of neoplasm coding, emphasizing behavior, topography, and morphology. The content includes specific notes and guidelines from ICD 10 volumes 1 to 3. It outlines the steps in coding neoplasms, including addressing benign tumors and assigning the correct multiple cause codes for a neoplasm based on behavior, that is, malignant in situ, benign and unknown behavior, as well as morphology and location. Additionally, the session explains how to assign an ICD-10 code in various scenarios, such as when the term itself indicates behavior, morphology, and location, or other information on the certificate that indicates behavior, or in cases where a benign neoplasm is reported as causing metastasis. Neoplasms are abnormal growths of tissue classified as malignant, benign, or of uncertain behavior. Neoplasms of uncertain behavior exhibit unpredictable growth patterns and pose uncertainty regarding their potential to develop into cancer. The growth of a neoplasm is uncoordinated with normal tissue growth, persisting abnormally even after the initial trigger is removed. This abnormal growth typically results in the formation of a mass known as tumor. The morphology of a tumor refers to its microscopic appearance. Pathologists use these codes to classify tumors for diagnosis, treatment, and research, with the classification system published by the WHO. The behavior of a neoplasm indicates its potential to spread to other parts of the body and be considered as benign, that is non-cancerous, or malignant, which means it is cancerous. The topography or location of the tumor represents the anatomical site and is crucial for cancer registries. For example, a diagnostic statement such as lung cancer, epidermoid carcinoma of leg, adenocarcinoma of femur, provides a detailed description of the tumor, including information on topography and morphology. The four major types of neoplasms behavior are malignant, in situ, benign, and uncertain or unknown behavior, each with specific characteristics and code ranges. Malignant neoplasms invade surrounding tissues and can spread to other sites with code ranges from C00 to C96. In situ neoplasms are malignant but confined to the tissue of origin, with code ranges from D00 to D09. Benign neoplasms grow in their original location without the potential for spreading, with code ranges from D37 to D48. Common types of benign tumors include adenomas, uterine fibroids, hemangiomas, and lipomas. Neoplasms with uncertain or unknown behavior have undetermined malignancy status, falling within code ranges D37 to D48. Most of the neoplasm coding guidelines are in the following sections of Volume 1 to 3. Volume 1 of the ICD 10-2016 contains topography codes C00 to D48, which are used to identify the site of neoplasms organized by body region. It is essential to read the notes and instructions at the beginning of Chapter 2 of the neoplasms on page 167. Volume 2 provides specific guidelines for coding malignant neoplasms utilizing 3 and 4 character categories and including information on special characters and symbols. Coders should refer to Volume 2 for consistency in neoplasm coding. Volume 3, also known as the Alphabetical Index, Neoplasm Guidelines, starts from page 435. It is crucial for referencing morphological descriptions, considering site, morphology, and behavior. General instructions in Volume 3 guides the coder on the correct use of the alphabetical index. It is important to consult specific instructions and examples in Volume 3 for accurate use of categories and subcategories in neoplasms in Chapter 2. The ICD-10 Chapter 2 focuses on neoplasms C00 to D48, categorizing them into malignant neoplasm C00, C96, in situ neoplasms D00 to D09, benign neoplasms D10 to D36, and neoplasms of uncertain or unknown behavior D37 to D49. Each block of codes corresponding to the behavior of the neoplasms classified within them. It is crucial to determine the behavior and site of the reported neoplasms accurately to assign the correct code. The recommended approach is to start by looking up the morphological term in the index to ensure the accurate coding of neoplasms based on behavior and site. Remember, use the morphological term reported as the primary term to reference in the index for accurate coding. For example, nephroma would lead to the code C64 for malignant neoplasm of the kidney in the index. Similarly, Kaposi's sarcoma would be indexed as a modifier under the lead term, such as C469 for Kaposi's sarcoma unspecified. In cases like villus adenoma, where the behavior is uncertain, it should be looked up under the lead term neoplasm uncertain behavior, leading to the code D489 for neoplasm of uncertain or unknown behavior unspecified. Utilizing the correct lead term in the index ensures precise and consistent coding of neoplasms based on their morphological descriptions. Again, remember that the morphological term reported serves as the primary term to refer to in the index for accurate coding. For instance, fibroma would lead to the code D219 for a benign neoplasm of connective tissue and other soft tissue unspecified under the lead term neoplasm connective tissue benign. Similarly, cancer of colon would be indexed under the lead term neoplasm malignant, resulting in the code C189 for malignant neoplasms of the coding colon unspecified. By following the lead terms in the index, such as neoplasm connective tissue benign or neoplasm malignant, coders can ensure precise and consistent coding of neoplasm based on their morphological description. This slide provides a brief insight to the neoplasm table in Volume 3, as it includes code numbers for anatomical sites and specific types of tissues. Many morphological terms have cross-references to columns in the neoplasm table for easy reference and accurate coding. The table covers various categories such as bone, connective tissue, and skin, non-melanotic, providing detailed coding for neoplasms affecting these specific anatomical sites and tissue types. By utilizing the neoplasm table, coders can efficiently identify and assign the appropriate codes for neoplasms based on their location and tissue characteristics. In addition, the note that neoplasm table in Volume 3 includes 5 columns for each anatomical site indicating the behavior of the neoplasm. That is malignant primary, malignant secondary, in situ, benign, and uncertain or unknown behavior. These columns help categorize neoplasms based on their behavior and provides specific codes for each type, allowing for accurate classification and coding of neoplasms affecting different anatomical sites. By referring to the neoplasm table and utilizing the behavior columns, coders can effectively identify and assign the appropriate codes for neoplasms based on their specific characteristics and behavior. Lastly, the neoplasm table includes notes and symbols to aid in correct coding. For example, a hashtag symbol for specific malignant neoplasm of skin sites, like the face, and diamond symbol for malignant bone sites, like the sacrum. Carcinomas and adenocarcinomas of any types are considered metastatics from unspecified primary site and coded to C795, with the exception of intraosseous or odontogenic cases. For sites under neoplasm connective tissue of various types like blood vessels, bursa, fascia, ligament, muscle, nerves, synovial, and tendon are coded according to the list under neoplasm connective tissue. This ensures accurate coding for different connective tissue-related neoplasms. Participants in this CWT can use the list of neoplasms in this slide as examples of coding malignant neoplasms. The steps to assigning multiple cause codes for malignant neoplasms involve determining the behavior, malignant, in situ, benign, uncertain, or unknown, for each neoplasm reported on the death certificate. Coders then decide whether to code the neoplasms as primary or secondary by following the instructions outlined in section 435A and 435B. When the term itself indicates behavior, refer to the alphabetical index for the specific term used to describe the neoplasm on the certificate. If both morphology and location are provided, look up the morphology term first in the index for accurate coding. For specific morphologies, the alphabetical index will provide the ICD code or guide you to the appropriate section under neoplasm. If the morphology is unspecified, refer to the neoplasm list in the index. and code based on site and behavior, as demonstrated in the example of primary lung cancer coded as C341. When both morphology and location are specified, such as malignant tumor in the left lung diagnosed as squamous cell carcinoma in the main bronchus, start by looking up the morphology term first in the alphabetical index. The morphology code for squamous carcinoma describes the cellular characteristics and guides you to the appropriate section in the neoplasm list in the index. The topography code, such as C340, for the main bronchus specifies the location, and integrating both the topography and morphology codes resulted in the integrated diagnosis like C340, referring to the main bronchus, squamous cell carcinoma. This process ensures accurate and detailed coding based on the specific morphology and location of the neoplasm. If the term used on the certificate does not specify behavior, search for other information that indicates the behavior of the neoplasm. Code a neoplasm of unspecified behavior or described as in situ as malignant if it is reported as the cause of or together with metastasis or infiltration. Additional guidance on coding malignant neoplasms as primary or secondary can be found in section 435B. In the example of a colon tumor with liver metastasis, the colon tumor is considered malignant and it should be coded as primary C189. This coding approach also applies to other types of growth, such as certain polyps that are not indexed in Chapter 2, Volume 1, ICD 10. If these growths are reported as the cause of metastasis or secondary tumors, they should be considered malignant and coded as malignant neoplasms. A neoplasm of unspecified behavior, that is, neoplasm cerebromeninges, should be considered malignant if it is reported as due to a malignant neoplasm. That is, in this case, malignant neoplasm of prostate causing malignant neoplasm of cerebromeninges. To determine whether the neoplasm is primary or secondary, refer to the instructions in section 435B, specifically subsection C, on other indications of primary malignant neoplasms. An example illustrating this concept could be provided to further clarify the coding process. If a tumor is indexed to the benign neoplasm section, but reported as causing metastasis or infiltration, check the alphabetical index on volume 1 for a code for a malignant variety. Code it as malignant if a code is available. Otherwise, seek clarification from the certifier. In the absence of a code for a malignant variety and no additional information, accept the statement on the certificate and use the code for a benign tumor. If there is no indication of malignancy, code the neoplasm as uncertain or unknown behavior, D37 to D48, following the rules and guidelines for mortality and morbidity coding. The steps in coding neoplasm is as outlined in this presentation. Step 1, beginning by identifying the histologic term associated with the neoplasm. Step 2, consult the neoplasm table in the alphabetical index which provides code numbers for neoplasms categorized by anatomical site and behavior, with 6 code categories based on behavior. Step 3. Verify the coding using the tabular list in ICD 10 Volume 1, which is organized by site and morphology, containing topography codes organized by body region. Refer to the notes and instructions in Chapter 2 of Neoplasms on page 167. Step 4. Follow the sequencing guidelines for primary and secondary foci, ensuring the correct code order. Step 5. Ensure accuracy by following the site rules outlined in Volume 2 of the Instruction Manual for Neoplasm Coding. These steps help ensure precise and consistent coding of neoplasms based on behavior, site, and morphology. Now, I would like to announce the next CWT, which will take place in May 2024, which is Session 2, Guidelines for Coding Malignant Neoplasms, Primary or Secondary. The objective of Session 2 is to delve into the guidelines for coding malignant neoplasms with a focus on correct multiple cause for neoplasm, determining primary and secondary categorization. The presentation will be based on Volume 2, Instruction Manual, Section 435B, Malignant Neoplasm, page 119, Rules and Guidelines for Neoplasm Mortality Coding in ICD 10 2016, Volume 2, which is available at the site shown in this slide. Lastly, I would like to remind you about the exercises for Session 1, which have been sent to everybody and involves 5 questions. Please complete the exercises and we'll discuss them in the next session. Thank you very much and goodbye.